¿Qué se escribe fuera? My name is Lisette Salvatierra Rojas. My topic is Old Woman with Lung Pleural Effusion and Hip Pain. Old woman with lung pleural effusion and hip pain. Definition: a pleural effusion is accumulation of extra fluid in the space between the lung and the chest wall. This area is called a pleural space. Approximately half of people with cancer develop pleural effusion. When the cancer grows in the pleural space, causes a malignant pleural effusion. This condition is a sign of metastatic cancer or cancer that has spread to other areas of the body.
Welcome to USMLEFasttrack.com. The section we're going to talk USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 561. What is pleural effusion? Pleural effusion is the excess fluid that accumulates between the two pleural layers. Pleural cavity is a fluid filled the lungs, so when you have excess fluid in this area, instead of the normal amount of fluid, this is called pleural effusion. Excessive amount of such fluid can impair breathing by limiting the expansion of the lungs during ventilation. Briefly, describe the difference between transudate versus exudate. We talked about the difference between transudate and exudate back in the pathology chapter, so we will highlight the facts again. Transudated fluid is the fluid that has less cell content, poor protein content, and the specific gravity is under 1.012, whereas exudated fluid is high in cellular content, rich in protein content, and the specific gravity is greater than 1.020. What are some causes that would lead to transudative pleural effusion? Transudative pleural effusion occurs in congestive heart failure, nephrotic syndrome, and hepatic cirrhosis. So in all these conditions, the transudative fluid is going through tight blood vessels. Name all the causes of exudative pleural effusion. Exudative pleural effusion occurs due to malignancy, pneumonia, collagen vascular disease, and all these conditions there is an increase in vascular permeability. So if you remember when we talked about exudate in the pathology chapter, we mentioned that exudative fluid and cells go through loose blood vessels. So it makes sense that exudative pleural effusion will occur in states of increase in vascular permeability. One additional thing to remember about exudative pleural effusion is that this fluid must be drained because there is an increased risk of infection. What is chylothorax? Chylothorax is a type of pleural effusion in which there is lymphatic fluid, also known as chyle, accumulating in the pleural cavity. What are all the causes that can lead to chylothorax, also known as lymphatic pleural effusion? Chylothorax or lymphatic pleural effusion can occur due to thoracic duct injury, which can happen during trauma, during cardiothoracic surgery, or due to a malignancy. Describe the appearance of chylothorax.
Be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high-quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.
Application in nursing. As the symptoms are difficulty breathing, dry cough, pain, feeling of thickness or wear in the chest, inability to lie down, inability to exercise, general feeling of discomfort. Nursing application will be to provide the necessary care to the patient to this type of feelings care such as giving support, controlling blood pressure, and controlling vital signs. Pros and cons. Pros. Large amount of liquid are evacuated through a tube inserted into the thorax. The distinction of the liquid allows the physician to determine the cause. Pleuritic pain due to pleural effusion disappears as the fluid accumulates. Conflict may accumulate in the pleural space as a consequence of a large number of disorders such as infection, tumors, trauma, hair, liver failure, blood clot, and the blood vessel of the lung of drug. Estos videos no tienen sonido. It should apply in Ecuador. The public health authorities do not have any medical problems and do not have equipment or implement necessary for the diagnostic and treatment of the disease. Emphasis should be placed on vaccination campaigns against tuberculosis. It is also important to prevent malnutrition characteristic of rural areas in order to reduce the risk of contracting this disease. Conclusion. Analysis of pleural fluid through thoracentesis allows a definite diagnostic to be made in more than 2 years of pain. The remainder may require a period of observation in the waiting for spontaneous resolution of the use of a non-invasive or invasive diagnostic method. Diagnostic and treatment in pleural effusion are very important for avoid complications and even death of the person which suffer.